Hi, class. Welcome back. It's Dr. Lindner. On the next section, we are going to be talking about the abdominal quadrants and abdominal regions. So this shows up quite a bit on the Connect quizzes from McGraw-Hill. So simple concept, if we draw this line, this mid-sagittal line this way, and this line going across this way. Remember, this is the person's right side, and this is the person's left side. This is what you have to get used to. Even though this is your reading left and you're reading right, we're always looking at it from the perspective of the patient. Okay, so we have the patient's right side and left side. So this is the right upper quadrant, and this is the right lower quadrant. This is the left upper quadrant and the left lower quadrant. And we're going to have different organs found in different quadrants. Now over here, notice we have the clavicle. If we were to draw this line straight up, whenever we draw a line straight up that separates the body into a left and a right half, you'll hear the word sagittal. But because this is right in the middle, they'll say that's mid-sagittal. That's a mid-sagittal line. If I were to draw another line here, up and down, we would say that that's parasagittal. It's separating to a right and left, but not equal halves. Okay. If I were to draw a line here, right in the center of the clavicle, we would say that's mid-clavicular, a mid-clavicular line. Okay, so right upper quadrant, right lower quadrant, left upper and left lower. And when we look at the different organs, we can see like the green organ right here is the gallbladder. That's in the right upper quadrant. So we can see that the small intestine is in all the quadrants, and even the large intestine, it's in all the quadrants. But let's say someone came in with right lower quadrant pain, a fever of 103-degree fever, and feeling nauseous, right? This is why knowing your anatomy is important. So we could say pain in the right lower quadrant, they have a fever, they have a high white blood cell count. What's going on here? Well, what is this thing called right there? Well, that's called the appendix. So maybe they have an appendicitis or an appendix that ruptured. Well, maybe the patient comes in with right upper quadrant pain, and they're nauseous after eating a meal, and they also have pain behind the right scapula, posterior right scapular pain, behind it on the posterior side. Well, it just so happens that the gallbladder produces bile, and bile is needed to emulsify or to break down fats. So if a person eats a fatty meal and then they have right upper quadrant pain and pain behind the right scapula, it's probably a gallstone, that one of these stones are getting lodged in this very, very narrow, tight ductwork over here. So that's why understanding where the anatomy is and understanding the quadrants is important. Now, besides quadrants, we have something called regions. And there are 9 abdominopelvic regions, and it's important to know their names. So if we start in the middle where the belly button is, that's the umbilical region. If we look above, epi means above, hypo means below. So there's an epigastric above the stomach and hypogastric below the stomach. The hypogastric is also known as the pubic region because it's near the pubic bones. Okay. Then you have a left inguinal area and a right inguinal region. Then we have a left lumbar region and a right lumbar region. Sometimes these are called left and right lumbar or left and right flank, the flanks where the love handles are. And then just under the ribs, we have a left hypo, which means under, chondriac, that's the cartilage of the ribs. So there's a left hypochondriac region and a right hypochondriac region. Those are the 9 regions. And again, I've seen these as a drag and drop. You can see here the umbilical, where the belly button was. Epi means above, so there was an epigastric and a hypogastric, but the other name for hypogastric is pubic region because of the pubic bones here. Then there's a left inguinal and a right inguinal region. There's a left lumbar and a right lumbar, also referred to as left and right flanks. And then just under the rib cartilage is a left and right hypochondriac region. Chondro is rib cartilage. Like some people get something called costochondritis, which is inflammation of the rib cartilage. And again, this is shown up on McGraw-Hill Connect as a drag and drop. You see they give you the options off to the left, and then you simply drag and drop them. So over here on the left side, it was just drag and dropping the quadrants. So there's a right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. Then they want you to drag what you can find in this portion of the left upper quadrant, which is the stomach. Here's the 10th rib. And here is the anterior superior iliac spine, right here. Okay. And again, you can see that we have different organs in the 9 regions. Okay. In terms of organs, most people refer to the quadrants. You'll see on most nursing and physician paperwork, they'll refer to right upper quadrant or right lower quadrant more so than they do the regions. Okay, good place to take a break. When we come back, we'll finish up with planes and cavities.